Hey. So yeah, maybe we can start. So hello everyone, really happy to be with you this afternoon. So for the plastic project webinar, and like the title is how to optimize the life cycle of medical plastic packaging. So basically, I will just a few practical information. So here is the program. So it will be like some 20 minutes presentation from the Climate Action Accelerator, then from ALIMA, and finally to Engineer Without Border from Norway. They will all talk about some project on recycling and plastic recycling. So this webinar is recorded, so it will be totally possible to see it on replay on our YouTube channel. Like, let's dive into directly our today's speakers. So we have with us Pascal Carré from our organization, the Climate Action Accelerator. We'll talk about one big project of these past years, the plastic project. And then we have the pleasure to have Jérémy Coutel from ALIMA, and he will also talk about more or less like the same big project, but another side of the plastic project. And then we are really, really pleased to have Nima Nemati from Engineer Without Borders Norway. Really happy to having you and to have the chance to have your experience on one of your projects in Somalia. A few information about the translation if you need. Probably you already know, but you can like put some subtitles thanks to Zoom. So here are some information. So a few words about our organization. So we are a non-for-profit initiative based in Geneva, and we work on projects mostly with organizations from aid, health, but also some education organization. And the goal is to like work on decarbonization trajectories, projects, and yeah, basically. So yeah, probably you already know our organization and our pillars. So I will dive directly with some words on our partners, some international organization partners, but also some local NGOs in like Africa, in Asia, and yeah. And so, yeah, maybe we can directly dive into like the topic with the presentation, with the Pascal presentation. So it will present some key recommendation on plastic recycling. So yeah.
Hello, then I will introduce you with our plastic project. We run this plastic project in partnership between ALIMA, which is based in Senegal, and the Climate Action Accelerator. The idea of the project is to address the plastic pollution, more precisely to reduce the environmental impact of emergency medical and nutritional intervention by optimizing the life cycle of packaging for certain medical supply, and by developing a sector-wide initiative. So we had a first project in Chad and Burkina Faso from 2022 and to 2024 financed by ECHO. And then a second project in Chad again and the Democratic Republic of Congo from 2024 to 2026, financed by CDCH, so the French CDCH. So the two projects are made in partnership between both NGOs, ALIMA and the CAA. Voilà, as part of our second plastic project that is finishing now, we are currently preparing a white paper presenting the main finding of the project. This white paper proposes seven-point approach. Some you should know, some are added by us from our experience in the project. So we have the first step of characterization and planning. Then second point on avoid and reduce, then reuse and repair. We had sort and collect because it seems important for us. We have for sure replace, recycle, and we want to insist at the end on staff and community as well, engagement and sensitization. But characterization and planning, it's a very important step at the beginning of it's the first step for proper waste management system. It involves sorting, collecting, and quantifying waste in terms of kg. This enables us to identify the main waste stream and to develop a waste management plan with specific and appropriate treatment method for each category. So then here we have the example of a work we did with sachets. We did this exercise of characterization on all the country of where sachets had 9 projects. So the idea is to weight all the waste by category. So we established the category by advance and to see where we have the hotspot in terms of category of waste, but also in terms of project. So we thought that the largest share is organic waste with 48%, after paper and cardboard 28%, and plastic. So with this method, we can see many things. We can do the percentage per project, per country, but also we can do it by intensity. So to compare the volume of waste and the number of staff and the number of beneficiaries. As soon as these figures are precisely collected, we can extrapolate and we can find many information from this methodology of characterization. So, and this here, you know where to put your effort. 48% of organic, that is very problematic in the landfill. So you know where to work. First organic, second paper and carton. The second point of our approach is avoid and reduce them. So the idea is to prevent waste generation at the source by minimizing the quantity of products and material produced, used, and consumed. Voilà, we have a very good example with the OPTIMA project run by ALIMA. It's a very good example of reduce by design strategy. The OPTIMA protocol for medical nutrition simplifies the diagnosis and the treatment, and then you can treat more patients with less resources, 30% more children with 20% less RUTF. This is by simplification of diagnosis, prevention, and different points that are included in the protocol. The medical protocol itself is reducing the plastic waste in this case. On the part of reuse and repair, the idea is to extend the lifespan of the product and material with repeated use, repair, repurposing. So here we have a very nice example from Engineer Without Border, Wait for Warmth, that is a reuse of plastic waste by transformation into insulation material, they can be used directly on the shelter. So sort and collect. It's quite important. For the plastic project, we are in rural area with big distance, and it's not easy to collect a very small bag like that, very small sachet like that. So the idea is to segregate and to recover the material from waste stream before they are disposed. We collect the material and we store it in a proper manner. We did that in the plastic project with ALIMA. We saw at the beginning we have a small box from the remote health center. After we have a big bag in the hospital. And finally in Jamena, we have a full container, transport of container that was after a point full of sachet of RUTF. At this stage, we had a big impact. There is no more plastic plum peanuts sachets in the environment, around the village, everything like that. So all the plastic is collected and securely, safely stored. So the impact here is we don't have any more leakage of plastic. That it's already a very good good point and essential point. Here we have a nice example showing what is possible in terms of replacement. It's about it's a research for alternative material and solution, focusing on substitute for plastic material, with at the same time to maintain the performance and to reduce the environmental impact. So Doctors Without Borders Switzerland launched a study to identify sustainable alternative plastic bag, like the small one you can see on the right side, that is widely used by medical NGOs to give daily drugs to the patient. So MSF explore bio-based and home compostable material. The picture is quite interesting. At the bottom, you can see the different plastic bag at the beginning. On the right side, you can see the plastic bag that we use today, who after a month, it's not moving, it's dirty, but it's the same. And on the left side, the plastic bag, who is degrading, who is damaged month after month. And at the end, at the top, you have nearly nothing. Well, it's a test of different plastic, bio-based. It's made of vegetal in general. Then here we come back to the plastic project we run with ALIMA. The idea is to transforming the plastic waste into a new project. So with the plastic project, we transform the sachet, who is non-biodegradable and difficult to manage, into building material through local processing of partnership. We did wall bricks with a mix of sand and plastic. We did some analysis mechanical analysis. They are very strong, much more strong than the regular bricks. And we have some other analysis looking for environmental impact of these bricks on the long term. But you see, we can do very good bricks from a simple mix of plastic and sand. Voilà, finally, our last point, that is very important because all the idea is to push for the engagement and awareness of the staff and also of the community. If you don't involve the stakeholder, staff, community, or maybe some other people, you will not reach any results. It's very important to bring everybody to speak and to share the project and to explain the project to the people. For example, for the plastic project, we did community sensibilization, and we have very good results. The mother of malnourished children understand very well, and we can collect easily a lot of not easily, but we can collect lot of sachets, 6 tons in total, by just explaining the project. Usually everybody understands very well because they also experience at home some problem with plastics and things like that. Well, with that, I introduce a little bit the speech of Jérémy. Voilà, donc...
Yes. If you have any question, like maybe we can wait until the end of the 2 other presentation. But yeah, thank you very much, Pascal. And then we will dive into Jérémy project and presentation. Thank you.
Hi, everyone. Nice to meet you all. So my name is Jeremy. I'm the head of environmental action at ALIMA, and I really welcome this opportunity to present the results of this common project that we run, that we have been running for 4 years now with the Climate Action Accelerator, and then the opportunity to dive deeper in the activities of the plastic project. So thank you very much, Pascal and Pauline, for today's webinar. You can go to the next slide. Maybe I will just share a few words about ALIMA because we are a medium-sized NGO, mostly operating in Africa, but we are not very famous yet, at least not as much as other NGOs. So we were created more than 15 years ago in Niger. We are very close to Doctors Without Borders. We share a very deep and common history with them. And we are now implementing projects and delivering emergency health care in 15 countries. Mostly in Africa, but we also had projects in Ukraine, in Iraq, also right now in Haiti. But yes, we are a very African rooted organization, and we have historical specialties in malnutrition, in disease outbreaks, but we are in the process of expanding our activities to the entire scope of primary and secondary healthcare, such as surgery, pediatric care, mental health, and so on and so on. In 2022, we published our very first environmental roadmap with the support and help of the Climate Action Accelerator. And this document was the very, by this time, the very first like strategical 360 degrees strategy for an emergency NGO who really wanted to address the climatic crisis and the environmental issues. So this roadmap helped us to shape the different ways we wanted to address those topics, such as the transition towards renewable energies and the phase out fossil energies, such as the way we transport people and goods and items on our fields of intervention, such as the way we travel by plane, by roads, etc. But also the way we want to reduce the waste that we produce every year in our projects. So we basically ran like a rough analysis of the typology of waste produced by our medical projects. And it appears that only like infectious waste only represent 30% of the waste that we generate in our project. The rest, the 70%, comes from non-infectious waste, such as plastics, aluminium, paper, and so on and so on. So we really wanted to address this topic of waste reduction and management. So you can go to the next slide. It appears that one of the most common items that we purchase and distribute to our patients every year is what you can see on the left of your screen, RUTF. RUTF stands for ready to use therapeutic food. It's basically something that you give to the patients that are struggling with malnutrition, especially children under 5 years old. So we basically buy 2 million of individual sachets per year, which ends up in nature. When you give them to the parents, most of the time they usually just throw it by the windows. It ends up in the streets, in the rivers, in the ocean, in the field. So this is a huge source of pollution that we really wanted to tackle. You can switch to the next slide. So just to give you an overview of the project, we wanted to tackle this issue through what we call the Plastik project that started in 2 sanitary districts in 2023, in Ouagadougou in Burkina Faso and in N'Djamena, Chad. Since we expanded this approach to all our nutrition projects in Burkina Faso and Chad, and we also implemented a pilot project in Bunia, DRC. Bunia is very famous right now because of the Ebola outbreak that you have probably heard of. And we are in the process of scaling up the project to other countries such as Cameroon, DRC, and others that are not shown on this map. You can skip the slide. So basically, you have to understand that the RUTF sachets is made of several layers of plastics and aluminiums. So we really wanted to have a broader understanding of how this sachet is really polluting environment. So with the Climate Action Accelerator and an independent consulting firm called Earth Action, we run a life cycle assessment of the RUTF sachets. And this really helped us to have a better overview of emissions at every step of production, transformation, distribution, and disposal of the RUTF sachets. You can go to the next one. And this life cycle assessment shows that more than I think, yes, it was more than 70% of the RUTF sachets environmental impact comes from the way it is produced, and especially through the agricultural goods that are used to produce, well, the product itself, like the raw materials used to produce the therapeutic food. So we basically have no hook on that as a medical NGO. What we can do is only to advocate to our suppliers, to the producers, to maybe shift towards a greener product through more sustainable and ethical raw materials extraction practices, through, for example, shifting from animal proteins towards vegetal proteins. But what we can really do at our own scale is to work on the distribution of RUTF, the collection of RUTF sachets, and the disposal of their waste. So you can go to the next slide. So yes, LCAs do not usually account for plastic pollution. So it really focuses on gas emissions, but we know that there is a huge issue with RUTF sachets, because they are at the source of an important local plastic pollution, which also comes with not only environmental deterioration issues, but also with medical sanitary issues for the local communities, for our staff as well, and we really wanted to work on that. So yes, you can go to the next slide. Yes, this is just to display the different type of materials that make the composition of the RUTF sachets, but I think we can just skip this one. Yes, so basically we designed the project by trying to identify at every step of the RUTF sachet life cycle what can we do. So we try to really design a 360 approach from the production step to the disposal step. So as I said before, we engaged with producers and suppliers, such as, for example, Nutriset or Mana, to see if they could maybe invest in research and development to develop some alternatives in terms of sachets, but also in terms of therapeutic food. So this is really something that this is a process that is very slow, because as you can figure out, this comes with a lot of commercial, industrial issues, and so we know that our suppliers are committed in this direction, but so far it's really slow. I will maybe come back on this later when we will talk about the challenges of this project. We also work on the procurement and transportation step by identifying when we can local suppliers. So at ALIMA we are working with Pamplinut suppliers based in Western and Eastern Africa. For example, I can mention Inofaso, which is which at the time was a very small startup in Ouagadougou, Burkina Faso. They are now like official pamplinut suppliers. They have a license provided by Nutriset, which is based in France. And they are working with local farmers to develop the therapeutic food to really like source raw materials really close to the areas where the RUTF will be distributed. When it comes to distribution, Pascal already talks about what we call the OPTIMA protocol, which is a simplified protocol to care for malnutrition. This basically allows us to buy less and then to use less RUTF to treat children for malnutrition with the same medical and clinical results. So this has clinical benefits, but also financial benefits for us and environmental benefits, as this allows us to produce less plastic and aluminum waste. We also worked with community leaders and other local NGOs to raise community awareness. So basically, we have people working with local communities and training them to the sachets collection and disposal. And we design some incentive systems when, for example, the mothers, because most of the time we are talking about the mothers, when they come back to ask for a new dose of RUTF for their children, when they come at the primary health center or to the hospital, if they give back the whole sachets, the medical staff gives them some wash kits, for example, some soaps, some hygiene products that they can use at home. So we try to work on incentive strategies such as this. We also created green areas very close to the hospitals, to the health centers, sometimes directly within the communities, the neighborhood, so people know that there are collection bins that are available, and it's really easy to just throw the waste in the right place. And in some areas, we also try to work with other nutrition actors, such as Doctors Without Borders, such as the Red Cross, to maybe increase the volume of waste that we were able to collect. Then we try to store in proper conditions the waste. So, for example, in N'Djamena, we booked a container that we put in the main hospital where we work in N'Djamena, and we just put the waste here before it can be recycled. So those are hermetic storage facilities, because we don't want the waste storage to come with, for example, rats or insects that could be the source of sanitary problems. And eventually, we partner with local recycling services providers in DRC, in Chad, in Burkina Faso. We made a mapping of those actors, and we partner with some of them to find some recycling solutions and to reuse those materials. And this is something that I will just show right now with a few pictures. And I will talk about the technical analysis in lab maybe at the end. So you can just show the next slide, Pauline. So just to give you an example, those are the bins that we put in the Nguri hospital in Chad. So there are different colors depending on the type of waste that is supposed to be collected in those bins. Next picture. This is an example of a green area that we built in a primary health center in Boga in DRC, and the ground is made out of bricks that we recycled from RUTF sachets. You can go to the next one. This is a washing activity, the washing of RUTF sachets by our hygienists in Ouagadougou. This is a picture of one of our partner, which is showing us the bricks that we built from the recycling of RUTF sachets in Bunia, in DRC, with a local NGO called CRID. This is the pharmacy of the Ngori Hospital. So as you can see, the black walls are made out of bricks that were built with by our local partner, Residep. Next one. This is another example of a storage room that we built in N'Djamena. So the added value of the bricks transformation process is that this is very easy to scale up. But we are also exploring other small-scale alternatives, such as this one. So this is a training that was run by our teams in Bunia, in DRC, and we basically work with local women to craft handmade bags that are made out of washed and recycled plastic, and they can then sell it on the local markets, and this generate revenues for them. And yes, just last picture. This is another recycling alternative that we experimented in Ouagadougou, in Burkina Faso. So basically, we found a guy who built a pyrolysis system. So this is a machine that you can see here. And thanks to this machine, we were able to separate the raw materials of the sachets. So oil, aluminium, and graphite of carbon. And then we can find other hands for those raw materials. So for example, the aluminium, the recycled aluminium was used to produce some cooking instruments, such as forks, knives, and so on. The oil is also collected and used it's used for our incinerators in the primary and healthcare centers, and in the hospitals we have incinerators that are used to burn, to incinerate the infectious waste. So we basically take back the oil from the plastic waste, and we use it for a second life in our healthcare facilities. So next slide. I think we are maybe running out of time, so let's just skip the video, but I will share the link with you later. So just a few results of the project. So basically, we avoided several tons of waste in the very first years of the project. So in Chad, we avoided 2.6 tons of plastic waste, 1 ton in DRC, and 2.5 in Burkina Faso. We have a pretty good ratio of collected and recycled waste. And thanks to those waste and our local partners, we were able to produce thousands of bricks that are used for local building and constructions. So those are like the main results of the project. And I will close my presentation by mentioning a few challenges that we faced and that we are still struggling with because the project is still ongoing. So in most of the places where ALIMA operates, it's true to say that there is most of the time there is a lack of local qualified service providers, especially in the most rural areas, because well, it's really hard to find qualified people, to find some like to find the right equipments. The supply is really hard because of the security contexts. So we are struggling with that. This is why in our budget we secured fundings that allowed us to make some cash transfers to the local recycling providers, and we helped them to like scale up, to buy some security equipments, to hire more staff, because we really wanted to support them on the long-term perspective. So this is really important for us to help them to like structure their activities. We also unfortunately witness a low implication of key partners like other nutrition NGOs, because well, they have to deal with their own priorities and timelines, and sometimes it's just really hard to find synergies because of that. But we have example of success stories in some places, for example in Bunia in DRC. So we are still very optimistic about that. One of the main question remaining concerned the chemical content of the bricks that we produced and their durability. So thanks to the Climate Action Accelerator, we are running some studies analysis in laboratories, just to see if we can really use those bricks for like sanitary buildings, or for building basically rooms or places that will be used by people, because we know that there are some chemical used in the recycling process. We know that there are microparticles of plastics that can be how do you say, that can like expand in the air. We want also to be sure that the bricks are robust and solid enough to build some walls or roof, for example. So we run some tests, and I can maybe talk about it later in the Q&A session. And well, the exit strategy of the project is also a huge question, because as many humanitarian and development projects, we mostly relies on international fundings, and as you may know, we are facing difficult times right now. So we are still trying to see how we can mainstream those activities in our regular projects and budgets, but sometimes we have to make difficult decisions and budget cuts. But well, that's life. Yes, I just had another very last point that I mentioned before, is that as you saw when I talk about the LCA results, most of the environmental impacts of the RUTF food and sachets relies on producers' choices, and this is still a challenge to us, because we have no hook or very just a few to make them work on this issue. So I think this is a collective effort that we have to make as buyers. So yes, this is also an interesting challenge that we identified. So I hope I wasn't too long. I will give the floor to the other speakers. So thank you, and happy to answer your question later.
Thank you very much, Jeremy, and thank you for your question. We can see so perfect. We'll just dive into them at the end of Nima's presentation. Thank you very much, Jeremy, and I give you the floor.
Thank you very much, and good afternoon, everyone, and thank you for having me. So my name is Nima Nemate, as was mentioned earlier. I work at Engineers Without Borders Norway, and a bit about our organization. Engineers Without Borders Norway is a non-profit organization which works with providing engineering expertise to the development and humanitarian aid sector. We have also been around about 15 years as ALIMA, and so fairly new organization, you could say. We work most often in close collaboration with other organizations, and all our projects is rooted in local needs and promote sustainable technology. We tackle usually technology challenges and deliver solutions customized to the specific project's needs. The solutions that we usually support in are owned and run by the local communities and contributed to an improved everyday life, basically. This project is one of the projects that we are running currently, and this one is in Somalia, or more specifically Somaliland in Hargeisa. The project is funded and supported by Innovation Norway, and in collaboration with World Vision International Somalia and Response Innovation Lab, which are the two or three organizations are in close collaboration implementing and supporting this project. Next slide, please. So about social plastics. So the problem in Somalia is very much like many other countries where proper waste management systems are not in place, and there is a lack of there are challenges with collection systems and other infrastructure that needs to be in place to do proper waste management. And what happens is also very common, that the waste that cannot be handled locally most often get burned, dumped, or buried. And this causes a lot of pollution, floods, cloggage, draining, and not less diseases and outbreaks. And limited recycling capacity and weak value chains reduces sustainable waste management. So the reason why this matters, I can again more or less say that it's also similar to many other relevant or alike countries where there is a lack of infrastructure, is that this crisis affects people mostly. In this case, Hargeisa, about 1.2 million people, and poor waste management harms public health and the environment. Women, informal waste pickers, and unemployed youth are mostly affected. Unsafe working conditions are limited income opportunities, increases vulnerability. And recycling and circular solutions can create jobs, and this is what we have also shown in this project. Strengthening ceilings and improve waste management systems and more sustainable and locally driven humanitarian efforts are necessary to be specifically on locally driven to be able to make sustainable solutions. Next, please. So the innovation that we have looked into. So we have tried to look at this project as holistic as possible to this specific problem in this specific context in Somalia. And we have done this through establishing local partnerships with local companies, one being Plastik, which is a small company, which I will come, both these companies I will come what they are doing a bit more detailed into. One is Plastik, which is a smaller company which have been working with developing payment tiles through recycling plastic. And the other one is Plastik, which is a larger company which has been mainly working with producing everyday items. They have a big catalog with everyday items, which has been then sold locally in Hargeisa. So they produce everything from chairs to buckets to bottles. So it's a big manufacturing company. And so our aim with this innovation has been to convert customer plastic waste into marketable products, producing pavement tiles and reducing plastic consumer goods, upgrading and fabricating local adapted recycling machines. That means basically building, instead of buying machines for some of these activities, building locally made machines that are fit for purpose based on what is possible locally and how can you get best business model out of it, so the business is actually worth developing. Building community-based collection and sorting and production systems, and fair wages and transparent value chains. We have also been working about integrating women, youth, and waste pickers into greener jobs. And a very important aspect has been that we have also conducted through a consultancy, we can bit back to that, behavior change studies, and are working currently on implementing campaigns to support behavior change. And strengthening the full plastic value chain and supporting, of course, climate-friendly businesses with long-term scaling potentials. And that's the two partners that we have from the private sector. Next, please. So diving a bit into Ecoplastik. So this is one of the partners that we chose to work with, and they had already established a plastic recycling system where they work with all these steps that you see here, from waste collections to pre-processing, local manufacturing of this then recycled payment tiles. So what they already had was working, but to be able to make a proper business out of this, they needed support on several aspects, as you see here. So we supported then Ecoplastik, or with our support, or our support and support from World Vision, which has been our partner in the field. And we engaged in the process of formalizing partnerships with existing waste pickers and waste picker associations. And we have established good systems to be able to sort, clean, and process collected plastics, focusing with this partner on low-value plastics. We have developed, together with our partner, developed a specific machine that will increase their production rate, so the business model becomes more valuable. And this new machine that has been developed with a focus on what would work in Somalia, and taking into consideration some things like energy cost. And for example, making this machine totally with no need for electricity or that type of energy. So, and one more important thing about developing this machine is that it has been totally developed locally in a local workshop, designed and supported by us, but also developed in a local workshop, making replicability a easier step for the future of scaling. And yeah, so the product that they are working on is basically, through a specific ratio, is melting plastic, blending it with sand, and producing tiles, very durable tiles. And they are affordable, and there is a big market for them in Somalia. And Ecoplastik aims also to increase its production volume towards the market, since the market is there. Next slide, please. So with ecoplastic, we were able to look at there was a partial solution of tackling some of the pollution that is present in Somalia. The other part has been done through the collaboration with Plastics, which I mentioned is a plastic production, so plastic equipment production manufacturer. So with Plastic, we went into the collaboration to try to convert their production to be done more through recycled plastic rather than imported virgin plastic. So before this collaboration, most of their production, except for that they did actually recycle their own waste, was done through imported virgin plastic. So we supported them in defining what they need, what kind of machinery, what kind of development did they need to do to their facilities to be able to handle recycled plastic. So there has been like plastic waste sorting and logistics, engaging with formal waste pickers, engaging with other venues where waste is present, for example, hotels, event areas, and other waste suppliers, and supporting them in also identifying how much and what kind of upgrades and development that they need to do to the facilities to be able to handle more plastics. So by doing so, we minimize their need for import of new plastic. We recycle already existing plastic and are able to produce more environmental friendly products. Next slide, please. So the social behavior study. So while it wasn't, to be honest, the social behavior study wasn't part of the scope at the beginning of the project. But while the project was ongoing, and this is a 2-year project, while it was ongoing, we understood a very large need to better understand the perception that local people in Hargeisa had around plastics, and that was different communities. Because having a holistic look at this, we needed to engage in how to also prevent plastic pollution. Recycling, working on collection, and reducing import of virgin plastic, we thought that was not enough. So what we did, it was to do through a consultancy, we did a proper study on how we could change the perception and attitudes towards plastic waste among different communities. And based on our findings, we are now currently developing and implementing awareness campaigns and community engagement activities to support long-term behavior change, increasing recycling practices, and strengthening local ownership and sustainable waste management practices. And this is simplified, for example, bringing it back to like where I live in Norway. Through the years, when I'm going to a store and the cashier asks me, do you want a plastic bag? I have learned to say, no, I have my own. That's behavior change that comes over time. And a behavior change about that streets are not necessarily for just throwing away garbage. If you get the proper infrastructure in, you throw it in the proper place. So there's many different aspects here that we are trying to get into through engaging specific communities and specific groups. Next slide, please. So the impact during the first 2 months of operations, which has now been, I think the impact currently is more or less when it comes around plastics 3 or 4 times more than what it says here. So during the 2 first months, we were able to recycle 8 tons or collect and recycling 8 tons of plastic, over 5 tons were converted into new materials for customers to purchase. 5 new jobs were created with Plastik, including 2 IDPs. Co-financing of the project inputs with the private sector, who contributed an additional $4,400 for machinery equipment. And over 2,600 kg of the plastic have gone towards the manufacturing of baby toilets and other goods. And we are working continuously to link the development of the goods towards the humanitarian supply chain based on the humanitarian need. And Plastik has also funded Plastik has funded a plastic waste collection point to into the town to build plastic, also to buy plastics from locals. Ecoplastic is now producing tiles at production place and a production rate that is financially viable, while recycling large amount of low-value plastic waste. Ecoplastic has also created 6 new jobs. Waste pickers are now both teams are now provided with dignity kits to promote safety and safety in waste picking, as they are already the most vulnerable, and many of them are IDPs. And going forward, we are looking into scale up, but we don't need to change to the next slide. So yes, coming up is the scale up. Can you go back to the previous slide? So I can take the scale up during that slide. Yeah. So to scale this, we are of course looking into how we can increase these numbers or in these activities. So one of the activities that specifically we are looking to scale is around the behavior change study. How can we increase those activities and focus more on that? And the other part is that Plastik is currently at a large rate, actually up to between 20 or 30% of their current production is being done through recycled waste that has been collected locally. But after identifying that there is a very good business model for a manufacturer as Plastik to doing this, they have shown a strong interest in increasing their recyclability to produce their products with 100% recycled plastics. So this is something that we will be working towards in the scale-up phase. This will make, of course, they will need a larger facility, more workers, but also in co-financing, Plastik being a business has also shown an interest of increasing their contribution significantly into this project. We are also trying to bring in other partners into this project to show even more focus to the humanitarian supply chain and the needs that are there. With Ecoplastik, we are also looking into increasing their production with more machines built and even more production as a larger production rate. And yes, basically, those are these things that going forward. But the reason is that I see that this is ongoing because we are now working towards developing all this and trying to understand what is needed to get the best, towards the best route for scaling this project. And that was me. Thank you.
Okay, thank you very much, Nima. It was very interesting. Yeah, thank you so much. Okay, great. So we have some question on the chat. Do not hesitate if you have other question, or you can also raise your hand on Zoom directly if you want to share our question or just if you want to talk on the topic. Maybe we can, so I saw that Jeremy has already replied of some question directly on the chat, but maybe we can share to everyone the question. If maybe Nima, you have some answer, or Pascal. Like,
yes, maybe it will be interesting to have the same question to Nima to see if we have a different answer than the one of Jeremy. So Jeremy responded already in the chat, but I think questions are interesting for everybody. We have this question from Kristen. How did the process of finding local recycling companies go? And how easy was it to find such companies that matched our recycling needs locally? But how do you identify the company in Ergesha?
Yes. So for us, we followed a model, which is a model that has been, well, we have worked with through several projects, at least projects that are supported by Innovation Norway, which we have focused on open market dialogues. So we started by focusing on the challenge. And going forward, we worked on trying to identify the specific needs towards that challenge. And what we did afterwards was engage with every relevant stakeholder and private sector companies that might be relevant in an open market dialogue. And after that, we launched a RFP, request for proposal, towards towards receiving ideas on how we could solve this problem. And then the process went after basically based on that.
okay, sorry.
Yeah, thank you very much. Jeremy, do you want to add something to this to the answer of Nima?
I think I already answered in the chat, but just maybe to stress the fact that you have to deal every time with local capacities, which is the sometimes which requires you to make some trade-off or compromises with your own local needs or requirements, but I would say that well, it's better than nothing, and the worst option would be to do nothing. So even if you know that you will contract with very with local organizations who have very structural weaknesses. Well, it's also your role to improve its quality of service, and this can be done by providing some cash transfers, for example. This is what we did, and this will help them to improve their own standards, security, equipments, their capacity, their volume capacity. So yes, it's really important to not aim for the perfect solution every time, but just to be realistic.
Okay, thank you, Jeremy. We have another question of Laetitia in the chat. So you answer already by writing directly, but I would like to add the same question to Nima. So Laetitia said, very interesting project. Thank you very much, Laetitia. And the question is, what was the cost implication of implementing those interventions, like washing the bags or collecting the sachet? I think in the case of Somalia, it's different. But if you have an idea of the cost implication, Imam?
Okay, sorry.
Yes.
Just Just
Yes.
before the reply, Jeremy, you raise your hand. Maybe it's about like the question.
Sorry, no, I just saw that Flavien asked another question in the chat, but maybe I will just give the floor to Nima to answer the previous question and then come back to Flavien's question.
Perfect.
Okay.
And just for
Governance.
perfect, thank you. And just for Laetitia and Kirsten, I transfer the reply. Normally, you can see the answers from Jeremy about your question, like written. Let me know. Oh, perfect. I can see them now. Perfect. Thank you. And yes, sorry, Nima, you can go for it.
Yeah, so this project was built, so the cost, the budget of this project was built in a way that most of the funding that we had available was set aside to allocate towards the private sector and their activities. Some towards our activities, of course, in the field and the support, but the biggest portion was towards the private sector's activities, which was foreseen. That was because the plan was all the ways to do this with the private sector. Specifics on how much it costs to do these different activities is that there is the biggest cost is not necessarily on collection, on manpower, or having people working with machinery or employees. Very often, the biggest costs are around having the right equipment and machinery to be able to do this. And let's say, for example, with eco-plastics, in their proposal to us, they actually wanted to procure specific machinery from Europe, which would most certainly help them in being able to develop these tiles that they wanted. But those machines were very expensive and at the same time required a lot of energy. And the energy cost in Somalia, which is in Hargeisa, which is run by diesel mostly, is very expensive also. So his business model would have been start with very big expensive equipment running on very expensive energy, which would then in the end ended up with having need to sell his product for a very high price to make this go around. So, and that's why we thought that locally developed specific equipment can drive that cost down and the entire cost of what they need. So that's why we worked on it in that way. So supplies, so working power employees are not the highest cost, and your main source of materials needed is basically everywhere. So that's the pollution. So you just need to organize it in a good way of being able to collect it and wash it in the most efficient way and reuse it. I hope that answered the question.
Okay, thank you. Thank you very much. Maybe we can dive into the question of Flavien. So I can read it. So, what is the attitude of the local governments concerning this innovative way of dealing with plastic, which is a big challenge of waste, as waste? Are they planning to sponsor such projects or scale it up at the country level? Very interesting. I don't know if Jeremy, because you worked in different countries.
Yeah, I can quickly answer to this question. So we always try to associate local authorities to our projects, including this one. So in this case, we closely worked with the local division of environment, but also with the sanitary authorities, like the local or regional representations of the ministries of health. Well, once they heard of the project, when we do the presentation, they are, of course, welcoming this kind of initiatives. they are opening all the doors that we need open. However, in most of the countries where we operate, I'm thinking about, for example, Chad or DRC, the local governments are also facing structural weaknesses and lack of resources and fundings. So they're really willing to support us and to learn from those local experiences, and sometimes they are really willing to scale up and integrate those activities to their own planification and public policies. But to be honest, it's really hard to have mid-term or long-term vision on what they plan to do because of the difficulties that I mentioned previously. So this is so I would say that they are willing to support us, but most of the time they don't have the capacities to do so, and most importantly to scale up locally. So yes, that was what this is what I can say. And sorry, I will unfortunately have to leave in 5 minutes. So you don't mind if I answer the last question from Kirsten in the chat?
Yes, please go ahead.
For it.
Okay, she's asking us if there are plans or activities that we plan to do, but along the way we learned that it was not a good idea or that didn't work, and we decided to quit or cancel. So, for example, the pyrolysis system in Ouagadougou, well, this was pretty innovative. But we are not sure that this is the most ecological and environmental solution. I think we can find more alternative, especially in Burkina Faso, where the local environmental ecosystem is very dynamic, So this is a kind of option solution that we experimented, but we are not completely sure to go on with this one. Also, during the transformation process in like in DRC to create some bricks, we made some slight adjustments with the producer, with our local providers after the analysis in laboratories that we did. Because, for example, we witnessed that there was a huge quantity of chrome, like the chemical components in the bricks, and we asked the local providers to reduce the quantity of these chemical components used during the transformation process. So yes, we are really in this pilot approach, learning by doing philosophy. We don't want to exclude any possibilities, so we just learning by walking, actually.
Okay, thank you, Jeremy. It's very, very interesting for sure. We are learning by doing, yes, for sure. Maybe Nima, you can answer to the same question to see your own point of view on this. The question of Kristen, I can repeat. A question for both projects. Were there any planned activities that you set out to do, but along the way learn will not work and you quit, cancel? As you have the experience of other projects, what can be the lesson learned in general, the message you can give to the other organizations?
Yeah, let me see here. With this project, there was few things, but actually, since Jeremy still is here, with projects that relate to pyrolysis, I've been there. There has been many things. And again, Jeremy, if you want to talk about your pyrolysis, I have some relevant information through other projects that I could share with you, if that might be of interest. specific to this project, you can see that, let's say, planned activities that had affected the project. So, working first of all, also a bit towards the previous question towards government and towards municipalities. So we have been very lucky to working with World Vision in the field with this project, and they have had such a great access and such a great connection with local municipalities, and bringing them early on board in this innovation and collaboration has been very relevant. We brought them on board very early in the market dialogue phase, where they are also involved in trying together with us to identify what are the needs and challenges and how can we tackle the problem. Going from there, there has been a lot of challenges when you're going towards the private sector. There's a lot of challenges around procurement and internal procurement systems, our requirements, and what can be delivered and what do we expect around from the private sector. So I would say that one of the main learnings I would share around working as a humanitarian with the restraints or with the barriers that we have around procurement towards the private sector is to really be aware of how much time you need to allocate towards to be able to do proper procurement. Because getting the private sector in, there's a lot of procurement that needs to be done. So that would be one thing, at least, with that project. Thank you.
Perfect. Thank you very much. So we have just like 4 minutes left. I don't see any other question. So maybe we can just like close the topic and just thank you for your participation. I hope this presentation, was interesting for you, for your next project. Do not hesitate to contact the Climate Action Accelerator or ALIMA or Engineer Without Borders if you have any further question on this topic or on any project. Just a few words. If you want to have the Climate Action Accelerator, we have our own solution hub with some toolkits, some solution fact sheets, many things very useful for your organization or your project. So you can directly find it on our website. And also we created an accelerator program for 8 organizations. So if you want to know more about that, you can directly see information on our website again, but also contact Alexa Leblanc from our organization. And thank you very much. Thank you for your participation. I wish you a lovely afternoon and a good end of week. And thank you very much. And thank you also our panelists, Nima and Jeremy. It was very good to having you and to have our experiences on your project. So,
thank you very much.
Thank you, Pascal.
And you have our addresses on the last page. You can see them. Please contact us or go to see our website online. Thank you, Nima. Thank you, Jeremy. Bye-bye.
Thank you very much.
Afternoon.
Thank you.
Thank you very much. Bye-bye.
Bye.
Bye.